Hey everyone, Luke here with the Knee Replacement Therapist. In this episode of the Knee to Know Show, I'm going to go over some easy ways that you can maximize your knee bending or flexion after knee replacement surgery. Before I jump into that, hit that subscribe button if you don't already, and be sure to hit the notifications so you can catch all of our latest videos. So first I just want to talk about some real general overall tips. If you want to skip ahead right to the exercises, feel free to do that below. But these are just some good general tips when it comes to range of motion and knee bending exercises. So the first thing you want to think about is, before doing your exercise, having pain and having any symptoms of stiffness or whatever that may be as much under control as you possibly can. So what I mean by that, so if you're taking pain medicine still, anything prescription pain medicine or anti-inflammatories or Tylenol, then you really want to try to take that maybe 20-30 minutes before your physical therapy session, before you do your range of motion exercises. Time it out so your pain is well tolerated and well under control. Some other things you can do to try to relax your knee and the muscles and soft tissue around your knee before you do your exercises is heat. A lot of people, there's some debate about using heat, but after those first few days, I'm really totally comfortable with putting heat on my patients 10-15 minutes, sometimes before exercise. Relax the muscles, relax all the soft tissue, and you can really tend to tolerate your exercise and your bending a little bit more. You can also use electrical stimulation, or TENS, you may hear referred to, and this is just using those electrical stim pads around the knee joint, again for pain management, to relax the muscles, relax the soft tissue, and help calm everything down. Now when you're actually doing your exercises, a couple important tips that I like to keep in mind is, one, try to distract yourself. You know, this is much easier said than done, but any way that you can distract your mind from focusing on the discomfort, the stiffness, the pain that you might be feeling is going to help you get some better range of motion. So listening to music, carrying on a conversation, doing things with your upper body like other exercises or other activities as your therapist works on your leg or as you're doing your range of motion tends to distract you just enough where you may get those extra few degrees of knee flexion. And you can also use TENS, continue to use the electrical stimulation and have that on and going actually as you're doing your exercises. So you don't have to remain completely still when you have electrical stimulation on. You can actually do your knee bending exercises with the electrical stimulation on. There's some other tips I like to provide with the exercises. I'll provide that here now as we'll jump into some of the most common exercises when it comes to maximizing and improving knee flexion. So here we go. First, some exercises that are just in a lying down position you're doing on a mat, your bed, your couch. One, probably the most common one you see, heel slides from lying down. I love to use a strap to provide that extra pressure or pull. Rolled up bed sheet, rolled up towel, a long belt, dog leash, anything that you can do to get around the ball of your foot will work just as well. Starting with the leg out straight, you're going to slide your heel as you bend your knee. You're going to get to a point where you can't really bend it up any further. That's where you use that strap to give an extra pull, hold it for a few seconds, and then come back down and relax. Usually I'll do maybe 2 rounds of 10 with my patients, but really you can do as much of these as you can tolerate and feel comfortable doing, working on that knee range of motion. With all knee range of motion, knee flexion exercises, there's a couple different ways that I like to divide them. So one is just doing quick smooth repetitions. So just going up and down, up and down, up and down. And then from there you can also do what I call moderate duration holds. So you get up, get to the end range, and then maybe you're holding that for 5 seconds, 10 seconds, and then letting it relax back down. And doing repetitions of those little bit longer 5-10 second holds. And you can also do getting up to the end range and doing a prolonged hold. So now you're at this end range of motion, and you're going to hold it for maybe a minute or 3 minutes. Really holding it at that end range for a prolonged time, and then back down. So that's just something to keep in mind with all of these exercises, is you can do nice, smooth, repeated motions or repeated repetitions. You can do those moderate holds for like 5 or 10 seconds at your end range, or you can do those more prolonged holds. And all of them have different benefits to them. So from here you can also do prone. I don't really do prone or lying on your stomach very often with people, just because it's not really well tolerated and the most comfortable thing. Also, you start to bring in your hip flexors, so you tend not to get quite as good a motion. But I know there's definitely some people who they swear by this position and they have good outcomes. So same thing, you're just going to bend the knee as much as you can. And then you're going to use that strap or whatever you're using, kind of like a pulley over your shoulder. And then you can give that extra pull, about a moderate intensity, hold for a few seconds, and then relax back down. Same thing, you can do the smooth repetitions, you can do the 5-10 second holds, or you can even do the more prolonged minute, 2-3 minute holds as well from this position. You'll notice much more of a stretch and pulling through your hip flexors. Another good general rule of thumb with these exercises is focusing on moderate intensity, finding that sweet spot to get some benefit, but not going so intense that you're causing extreme exacerbations of pain. You're going to have some pain and discomfort, especially early on after surgery as we start to push that boundary, but we don't want to go so intense that you're really aggravating your symptoms so much that you can't tolerate doing more exercises the rest of the day, or maybe even a few days after that. So find that sweet spot, not too little that you're not getting benefit, but also not too intense that you're not exacerbating your symptoms. From here, we'll go ahead and show you some things we can do from a seated position. So from a seated position, you can also perform heel slides, and I still like to take advantage of that strap or whatever you're using as a strap. Again, trying to get it around the ball of your foot, and then I actually like to use a chair that I can kind of put the strap under the chair behind the back leg, and then I'm actually going to pull it from the other end, again using kind of that pulley as an assist. So same thing as lying down, you're going to slide your leg back as far as you can, bending the knee. When you get to that stopping spot or sticking spot, give that pull through the strap, through the little pulley you've created, and then relax back down. A couple other things to keep in mind is make sure you're sitting up forward with enough of your thigh off the chair so that you have room to bend that knee back. You can also use your opposite leg to put some pressure into the knee to bend it even further. And then you can also use the leg from behind their surgical leg to assist it back to the starting position. So again, sliding the leg as far as you can comfortably, using the pulley and or your other leg, pushing it back in that extra little bit, doing either our medium hold for 5 or 10 seconds, or more of a prolonged hold for a couple minutes if you want. And then as you relax back out, you can actually use that opposite leg behind it to slide it back out to the starting position. Okay, so now we're going to go ahead and show you some exercises in a standing position for knee bending or flexion. So from a standing position, I like to have something in front of me to hold on to for support. Ideally, this would be a countertop, sturdy kitchen table, but just for demonstration, I have the chair here today. Again, we can take advantage of that strap, getting around the ball of your foot, and this time it's actually going to come up kind of behind your shoulder. So again, working on flexion or bending, you're going to bend your knee up as far as you're able to, and then you actually can use that pulley of that strap, give that extra little pull, hold for a few seconds, and then relax. Give that pull, come up, hold for a few seconds, and relax. As you get more range of motion, you can also use just your hand. So if you get the leg up here, and you can grab it with your hand and get the pull or the stretch from there as well. Again, we can do our quick repetitions or smooth repetitions. We can do our holds for 5 or 10 seconds, or we can even do our prolonged holds. Some tends to be a little trickier when you're standing, but you can do it. Also, a good thing to know with any standing weight-bearing exercise, you really are working on your range of motion. So if you're doing body weight squats, you're getting that deep flexion and bend of your knees. You're doing lunges, same thing. So I'll actually show you one here. This is one of my favorites. Usually I incorporate this after a few weeks of rehab. You're going to get your surgical leg up on a step, and from that step you're just going to lunge forward and come back. Lunge forward and come back. And you're actually using your body weight to bring the knee into a bend, into a flexed position, and then come back out of it. As you get more range of motion and more comfortable, you can go up to a little bit higher step. So pretending this is your step, you've probably progressed pretty good at this point. Bending forward, hold, and then relax. And again, you can see how you can do just your smooth repetitions in this position as well. Again, this is a little more advanced. You've probably been going through rehab for at least a month or a couple months at this point before you can really tolerate this level of pressure and range of motion. But a good one nonetheless. So just overall principles before I wrap up here is think about trying your exercises in a wide variety of positions. You don't have to do anything too crazy. There's all kinds of strange and different ways to work on your knee flexion. But really, if you stick with these core exercises and just try them in varying positions, that's going to help your neurological system, help your muscles kind of feel these different positions. And most times people will find that one of the positions, lying down, seated, standing, works a little bit better, and they're able to get more range of motion in that position than some of the others. Some other things, if you're really struggling with your knee flexion, considering pedaling, recumbent bike, a great form of warm-up or cool down, or just exercise on itself for working on your knee flexion. Think about aquatic therapy, getting in the pool where your muscles and joints are a little more relaxed, a little less stress through the joints. Can be a really great form of full body exercise, but also for your knee range of motion and bending and flexibility. We talked about TENS, electrical stimulation. Getting on a new step machine, if you've ever used one of those, is a great option as well. And if you're really struggling, there are some different devices out there, some knee bending, knee flexion devices that you can rent or purchase through your therapist or through a vendor that tend to have some really good outcomes. They help provide a little more force, provide that prolonged stretch or that prolonged hold to help improve your range of motion after surgery or otherwise. So I hope you found this video helpful and insightful, gave you some tips, some exercises and things you can do to improve and maximize your knee bending after knee replacement surgery. Please be sure to leave your questions below. Hit that like button to spread this video. Thank you very much for watching.